Good morning, everyone, and welcome. Thank you for joining us today. I'm Jeff Babe, and I'm thrilled to have you here with us as we share updates on our board leadership team, highlight our upcoming chapter events, and walk through our roadmap for 2027 as part of our Coffee Chat webinar series. I'm joined today by Art Nicholas, our chapter secretary, along with our moderators, Jyotsna Alu and Rutendo Godo. And together we'll take you through our recent chapter milestones, what we learned from our spring board retreat, some of the key decisions that we made, and how we're shaping the year ahead. But before we jump in, we're going to start with a quick round of introductions. I'm Jeff Babe, the incoming chapter president for the HIMSS Michigan chapter for our new fiscal year, which begins July 1st for fiscal 2027. And I'm based in Dexter, Michigan. And I'm honored to serve as the HIMSS Michigan Board of Directors for the last 3 years, working on the programs committee with the team here and the rest of our board members. And outside of my HIMSS Michigan work, I also currently work with Zoom as a global program manager in the healthcare division focused on virtual care and telehealth solutions. And I'm honored to be here with you today. So with that, I'll pass it over to introductions with our moderators, starting with Jyotsna. Over to you.
Hello, everyone. My name is Jyotsna. I recently graduated from Grand Valley with a master's in health informatics. I'm the 2025 scholarship recipient and a student leader of Michigan HIMSS chapter. Now, I will pass it on to Rutendo.
Okay, thank you, Jyotsna. My name is Rutendo, and I serve as the Professional Development Chair in the chapter. In that role, I've had the privilege of leading several initiatives focused on developing and supporting the next generation of healthcare, IT, and healthcare leaders. I also have led initiatives such as our scholarship program, the mentorship program, and currently we're working on the Emerging Leaders session for the fall conference. And outside of HIMSS, I'm a PhD student. I run a small business. I'm also a performance and efficiency manager for a small home care business in Lansing. And with that, I will hand over to Art.
Good morning. Great to be here. Art Nicholas. I'm currently the chapter secretary for the Michigan HIMSS organization. I'm starting my 5th year as a member of this chapter. Really loved my ability to meet people. In addition to being chapter secretary, I'm on the membership and programs committee. And I'm kind of our de facto west side of Michigan champion. I'm based in Saugatuck and very excited about what we're going to be sharing today, not only for my fellow West Michiganders, but members of the chapter throughout the state. When I'm not operating in this role for HIMSS, I'm Chief Growth Officer for Interlace Health. We are a healthcare-based software company supporting hospitals and health systems all over the U.S. and Canada.
Thanks, Art. Well, let's jump in and get started.
Thanks, Jeff and Art, for your introductions. Thanks, Rutendo. Jeff and Art, I have a question for you. Michigan HIMSS had a strong year in 2026. What accomplishments from the impact report stand out most to you?
Sure, Jyotsna. Well, 2026 was a year of building and acceleration for our chapter. Starting off in September with our 2025 fall conference, we had one of our largest turnouts ever with over 250 participants, 30 speakers, almost 35 sponsors and community partners involved, and 2 full days of content. And feedback from our members and our community was really overwhelmingly positive. And that led us into October and some new community partnerships with C3 Tech Advisors at the C3 Tech Summit in Grand Rapids, where we joined with over 600 people and led a HIMSS Michigan breakout session on the future of health data and health data management in the state of Michigan. And going into 2026 in January, we built new academic partnerships with University of Michigan, kicking off the industry dinner. We also added university affiliations with University of Cincinnati, Davenport University. We grew our partnership there. And really was a year of rebuilding around our communications and marketing, and so many highlights. I guess, Art, what's top of mind for you?
Yeah, I think in addition to those great activities and expanded partnerships, we really worked diligently to improve and expand communications within the chapter. Jeff and I were just speaking a few minutes ago, and the number of followers for our LinkedIn profile and group, for example, has grown 51% year over year. We've started a quarterly newsletter that the next one will be coming out in July, among more frequent outreach to the members in general. Also very excited about the continued expansion and success of our advocacy group. Michigan HIMSS has contributed to the national HIMSS policy discussions, as well as been very diligent and engaged in Michigan-specific health, digital health priorities. So those two, in addition to expanding our partnerships with a greater number of health systems, which you're going to see in this fall conference, but not to give anything away. Those are the things that come to mind for me.
Well, great. You talked about rebuilding, and 2026 was a year of rebuilding and acceleration. I know you recently held a board retreat in May. What are the biggest takeaways for the leadership team?
Well, I'll start with that, Rutendo. And our spring retreat in May was a great session in terms of shaping our board and our chapter for the year ahead. And if I can share a couple of slides, I don't want to go through a long slide presentation, but I did want to share a couple of updates. And starting with, just for anyone that's new to the HIMSS Michigan chapter, really quickly introduce who is HIMSS Michigan. We're a nonprofit organization of roughly 1,700 members across the state of Michigan, dedicated to improving information systems management in Michigan's healthcare institutions and health ecosystem. Our chapter was formed in the spring of 2002 by our chapter founder, Helen Hill, who is still active on our board and was the recipient of this year's HIMSS Changemaker Advocacy Award. And our vision is to realize the full health potential of every human everywhere. And our mission statement is to reform the global health ecosystem through information and technology. And we are proud to say that we are also a HIMSS Gold chapter, which is the highest designation of chapter recognition. And we've achieved that 3 years in a row. There's 58 HIMSS regional chapters in the United States, and less than 20% of those achieve that designation of gold chapter status. So really a credit to our members, our sponsors, and our board and our community to achieve that gold chapter status. So I'm proud to recognize that. Our spring retreat is where we get together every year and look at the upcoming fiscal year, which starts July 1, and we set our bylaws for the year. We look at our charter, and we also look at the structure of our board, our executive board members, and our committees. So I'm happy to share a couple of updates. As the incoming president-elect on July 1, I'll officially start my term as chapter president with gratitude and thanks to Mike Wall, who will then move to the immediate past president and has led our chapter as president during the past year. And I'm also excited to share that we nominated Art Nicholas, who has served as chapter secretary for the past 2 years, as the incoming president-elect for FY27. So just take a moment and say congratulations, Art. I'm very excited to partner with you in the year ahead in this role.
Thank you, Jeff.
Also wanted to share that Linda McMillan, a longtime board member and active HIMSS Michigan member, has volunteered and been nominated to take the role of the new chapter secretary. Very important for our continuity, very important for our governance on the board. So thank you, Linda, for taking that role on. And both of those positions will be voted in by our members. Art has recently sent out a direct email to all of our membership to vote in those executive board positions. And beyond that, we have some additional changes that have been made to the board. Rutendo, who is the chair of our professional development committee, has added some additional working members to lead the mentorship board. And that's now up to 3 working members, and working on adding an additional co-chair to professional development. So that is a spot that we're actively filling right now. We also added Andy Hoying, who has been a longtime working member and supporter of our programs committee, to officially nominate Andy as co-chair of programs for the chapter for the year ahead. So congratulations.
Thank you, Jeff.
Excited about that. Working members to communications and marketing committee, as Art mentioned, assigning some different roles activated, focused on our newsletter and communications and social media, growing our LinkedIn followers. So really thrilled about that. And when I think of our accomplishments, one of the highlights that really stands out is the formation of our advisory board for 2027. Dr. Michael Zarukian, Isabel Pacheco, and Betsy Freeman, 3 luminaries from the healthcare IT industry in Michigan, with too many accolades to count, active members of the HIT Commission, leadership and advocacy, interoperability, statewide health data exchanges, and cybersecurity. This board will be leading our strategic direction, strengthening our partnerships with other community partners, and ensuring that our chapter continues to deliver value to the health IT community in Michigan for the year ahead. So thank you to our advisory board members. With that, I'll stop on our roadmap and kind of pause over to Art. Anything from the spring retreat that I missed, or anything you'd add?
Yeah, the thing that I would add in general, and I think it was highlighted as well at the spring retreat, is we're really, really beefing up our professional development and our efforts at supporting future leaders. You're going to see that throughout events that take place in the summer, fall, and upcoming winter. That's something that we've talked about doing, but I think we're really leaning into it, and Rutendo has been a big part of helping us in that area. And we want to make sure that we highlight that.
Absolutely. Great call. And also wanted to mention that we have added some roles and co-chair members to our membership committee. So also looking to strengthen our membership engagement and expanding the scope of that to membership, organizational affiliates, volunteers, and working members of the board. So really looking forward to that as well. And Sharon Kim and Linda McMillan have taken an active role in also helping drive that membership committee. And
Yeah, Jeff, the other thing I would add is, like any organization, it's really imperative that we constantly are looking at succession planning. And for those of you in the audience, 3-4 years ago, I was one of you and had the opportunity through mentoring and assistance from board members to get more engaged through committee, and then eventually on the board, and now part of the executive board. That's something that we constantly are working on.
Okay. Thank you so much. Now that we've covered leadership and strategy, let's bring it to life. One of the biggest ways members experience Michigan HIMSS chapter is through the fall conference. What can you share about what's new, what's different, what the attendees can expect in this coming fall conference?
Jeff? Sure, Rutendo. We are very close to announcing our agenda and sharing the registration for our September fall conference. But we have confirmed some keynote speakers and some headliner content, and we're making some changes to the format this year. And one of the changes I'm really excited about is on Monday, September 14th, we are adding 2 parallel tracks, and we will have a track for emerging leaders and professional development, which you are kindly leading the curriculum for that and the sessions for that track. And at the same time, we'll have a track for advocacy and public policy. We have such a strong advocacy committee, and we've really set the bar nationally for our work in advocacy, tribal health, and public policy in the state of Michigan. So that will have some content and some working sessions on Monday the 14th. On Tuesday, September 15th, we are adding a 3rd track of focus for IT business operations and looking to have some new and exciting format for our vendor expo hall and a lounge area for business operations and some breakout sessions. So some new format that we haven't done in the past. I think it'll continue to raise the bar of our fall conference. And of course, we're going to continue the golf outing this year. So we've secured 54 spots at Hawk Hollow, which is a fantastic golf course just outside of Lansing. And our conference will be at the Lansing Center. So September 14th and 15th, I'll share more information. But Art, anything that you would add?
Yeah, just a couple of things. I think attendees are going to be really impressed with the lineup of speakers that we've been working on, including engaging additional provider organizations that maybe haven't participated in the last few years. Some of the other topics, just to not to do a spoiler alert, but as you might expect, we're going to have themes related to agentic AI from pilot to outcomes. It's always important. Hot topic of conversation is interoperability and data exchange. And we're also going to make sure that we cover public policy and advocacy, as Jeff mentioned before, covering areas of tribal health, also rural health, because that's a timely topic, and clinical workforce transformation, among others.
Well, if I can go ahead and I'll give a little bit of a preview. We have 2 keynote speakers that I'm really thrilled to share. Dr. David Lanphier, who is Chief Scientific Officer and VP of Research at Henry Ford Health, will be headlining one of our sessions. And Dr. Lanphier is leading the partnership with Michigan State University, so we'll be talking about that. And also Lucas Kowalczyk, who is also a medical doctor and executive medical director at Provation. He also serves on the HIMSS National AI Physician Committee, and we'll be talking about agentic AI and clinical workflows. So very excited to have both of those speakers headlining at our event. And
that sounds really exciting. I especially like the mix of emerging leaders, AI, interoperability, and professional development. It sounds very valuable, but for both the healthcare professionals and students. What new or expanded programs should members look forward to this year?
Art, do you want to take this one?
Yeah. So you're going to definitely see expanded webinars and a whole series of webinars really aligned along the same tracks that our National HIMSS organization is focused on. As we've touched on several times, you're going to see the growth of our mentorship program, more mentors, more opportunities for that kind of growth, professional growth. We are definitely going to be sticking to at least one newsletter a quarter with more thought leadership in addition to updates. You're going to see more community events, both virtual, coffee chats like this one, roundtables, networking events. We've done a pretty good job of doing that in a couple areas. We want to expand that throughout the state for the in-person events. And we're going to increase the number of opportunities for people to contribute content, to speak at events, to host events, and to participate as part of the chapter. Jeff, anything you wanted to add to that?
Well, I'm also really excited about the growth in our academic partnerships and the engagement that we're having with our emerging leaders and next generation of leaders, the students, recent MHI graduates like Jyotsna here. And we have 12 mentees and 9 mentors as part of our inaugural cohort for our mentorship program. And that's really feeding into the next generation of people that will be working with our board and supporting our chapter for the decade ahead. And in addition to that, as you mentioned, we're not only having more webinars, but looking to hear from our members. So we have a member survey that will be shared at the end of this session and sent out to all of our members. And looking to really increase our communications, the consistency of our newsletter and our social media postings. So lot of opportunities and a lot of growth for the chapter.
Yeah, that's a lot of engagement opportunities. Another important dimension is advocacy. How is Michigan HIMSS strengthening its advocacy presence at the national and state levels? I don't know. Art, do you want to go first?
Yeah, I'll start that. First, I want to acknowledge that we have had a very strong advocacy program for a number of years, both in terms of working within the national HIMSS advocacy initiatives as well as Michigan-specific priorities. But our team is never satisfied with where they are and are always looking to expand and improve their efforts. In terms of Michigan-specific priorities, I mentioned earlier, interoperability modernization is a continued area of need. Rural health transformation is a big area of opportunity and need for advocacy and participation, as well as, digital equity and access to broadband. And, something that's growing as a concern for Michiganders is responsible AI governance in healthcare. Jeff, anything else you wanted to add on that point?
Yeah, Art, I would be remiss if I didn't recognize the role that Helen has played in our advocacy committee and as advocacy co-chair. I just wanted to share this slide and recognize Helen's 2026 Changemaker Award from the HIMSS National Organization, which is recognition for the leadership and advocacy that our chapter and that Helen has brought. And really wanted to also recognize Crystal Schramm, who has been leading the tribal health component of our advocacy committee and has really established that as a national standard and is involved with HIMSS National in advocating for tribal health in Michigan and the Great Lakes region. So those are 2 areas. As you called out, rural health, our collaboration with Michigan Department of Health and Human Services through the HIT Commission, where we currently have 3 board members that are also active in the HIT Commission. So our collaboration there is really crucial to our ability to shape and be part of that conversation for public policy in the state of Michigan.
Thank you, Jeff. And it is very, very encouraging to hear how Michigan HIMSS is connecting advocacy with healthcare priorities. Going to the roadmap, what does the Michigan HIMSS 2007 roadmap looks like?
Jeff, why don't you get us started on that? You've been really instrumental in putting that roadmap together along with the board.
Sure, Art. This is something that's been a work that really started back in the fall. But if I can go ahead and share an image here and jump into the 5 pillars of our roadmap. And I will, sorry, let me get on the right slide. Our 5 pillars of our roadmap are leadership and governance, community and membership, advocacy and public policy, learning and professional development, innovation and partnerships. And these 5 pillars really are where we have to be aligned on all of our goals and objectives. So as we look at what are we doing, where are we investing our time and our resources, wanting to make sure that we're supporting the 5 pillars of our chapter that are aligned with our mission. And most importantly, that those 5 pillars are built on a foundation of our culture. And as we talked about this at our spring retreat and really thought about what makes our chapter strong and what makes our chapter kind of special and bringing members together in this community is the culture that we've built. And our HIMSS Michigan chapter is built on a culture of service, inclusive collaboration, professionalism, continuous learning, and community impact. So I won't go through all of these in detail, but each of these pillars, we've established a set of objectives and some metrics as we look through community and membership, advocacy and public policy, setting up our goals for the year ahead. For example, learning and professional development, increasing the number of CA HIMSS, CP HIMSS, developing more funding for our scholarship program, funding that through 2028, the mentorship program, which we talked about, our innovation and community partnerships through the health IT ecosystem in Michigan, growing sponsor and partner engagement through social media, regional events, and innovating in our AI Center of Excellence and leading with the discussion on some of the new agentic services and clinical workflows. So those are some of the things in our roadmap that I'm excited about, and those are the pillars that are really shaping our strategy for how we want to lead this journey through the year ahead. And Art, I guess anything you'd add?
I think you covered it. The only thing that I would highlight, and you touched on this, is you're going to see us continue to expand our partnerships, with organizations. We've had a wonderful partnership with C3 this year, which you mentioned before, as well as the University of Michigan and several other educational organizations. We've begun outreach with sister associations that touch on healthcare and healthcare IT, and we'll have more to share on those relationships in the coming months.
Great. Thank you. As we bring this conversation to the end, from the momentum in 2026 and the vision of 2027, what's the clearest call to action for members and those who want to be part of our chapter?
Well, I would say a call to action for our members is find any opportunity to get involved where you want to contribute or leverage your experience, your strengths. That could be joining a committee as a working member. We can always use support and help in our programs committee, our communications committee, membership. We have a strong advocacy committee that can always use more support. We could use volunteers at our fall conference or for other regional events. We can always use speakers for webinars. We can use contributors for articles on our LinkedIn site, for our quarterly newsletters. We also have opportunities for mentors as we've launched our inaugural mentorship program. We intend to continue that. So as we build our next cohort, we'll be looking for mentors to help support our mentees on that journey, and really contributing to our collaboration with our community partners and expanding our statewide outreach through that partnership and and working together on initiatives around Michigan's health IT and interoperability. So those are some of the opportunities to get involved in terms of call to action. And anything else?
Yeah, there was a lot of great opportunities that Jeff outlined. I want to just spend a minute on the why you should do this. I can tell you from the time I attended a networking event 4 years, a little over 4 years ago to now, I have learned so much more about the Michigan healthcare ecosystem. I had no idea what a physician organization was. I really didn't understand how HIEs worked. I didn't understand the challenges that were, frankly, unique to this state. And through becoming engaged, I've learned a tremendous amount more, which has helped me in my professional life. But in addition to that, over the last few years, I've established some fantastic friendships with people I can't wait to see in person, whether it's out in Las Vegas or at our golf event coming up, et cetera. It's truly the culture of this chapter is really, really special. And the best way to appreciate that is to get engaged in one of the things that Jeff mentioned as a starting point. And you'll be amazed at how quickly you'll be embraced and establish both professional and personal friendships.
Art, I'm glad you mentioned that. And if I can share one last slide here or visual aid, I wanted to encourage anyone on the call to come to our summer golf scramble, June 22nd in Grand Rapids. It will be at the Indian Trails Golf Course. If you're interested in getting more involved with the HIMSS Michigan chapter, this would be a great opportunity to meet with our board members, meet with other chapter members, and to have fun. It's going to be a very casual golf scramble. Beginners are welcome. First-time golfers are welcome. Everyone will have a good time. We're going to play 18-hole. It includes the cart, live scoring, leaderboards, and a dinner with City Barbecue Taco Bar, and we're going to have some prizes and have a lot of fun. So June 22nd, save the date. And if you can't make it, please share that invite with your friends, your network, and hope to see you there. So that's my last call out for call to action.
All right. As we conclude today's coffee chat, please take a moment to complete the survey at the end of the session. It will be emailed to you, I think, or to pop up on the screen as a logout.
Both. I think you'll at the end of this call, you'll get a survey right in your browser, and we will also be emailing it out to all of our registered members.
Okay, thank you, Jeff. Your feedback will also help us better understand your needs and continue improving our programs and events. Thank you to Jeff. Thank you, Art, for sharing the insights and the vision for Michigan HIMSS. And thank you to my co-moderator for helping me facilitate today's discussion. We appreciate everyone who joined. We look forward to seeing you and engaging in conversation at the next chapter event. Have a great day.
Thank you.
Take care, everybody.